Welcome to my presentation for the Canberra Health Services 2026 Registered Nurse Graduate Program. My name is Nicole Smorin. I'm a wife to Jay, mum to Archie and Rose, and a Groodle lover to Marlo. I'm currently work as an enrolled nurse on 14A Haematology. I completed the EN grad program in 2021 with placements on 10A and geriatric rehab at UCH. As nursing is a second career, I bring strong communication, critical thinking, and interpersonal skills. My previous background shaped a clear and professional communication style. One of my greatest strengths is building a rapport with patients, families, and the multidisciplinary team. Working in haematology, I care for patients newly diagnosed, critically unwell, or end of life. These moments demand compassion, empathy, and if appropriate, humour. I pride myself on reading the room, sitting at the eye level of a patient, offering tissues, or simply holding a hand. If a patient is celebrating a birthday, I'll arrange a cake and rally the team to come and sing. When washing a bedbound patient, I ask what music they like. There have been times I've given a bed wash to the 80s hit Africa by Toto, and nothing gives me greater joy. I communicate respectively with everyone, from the cleaners to consultants, because clear communication is crucial in a fast-paced clinical setting. I follow the communication for safety standards during handover and documentation. After a recent ICU placement, I have been inspired to improve my own handovers, which is something I work on every day. Medication errors are the most common healthcare-related error. They can stem from miscalculations, incorrect dosage, or drug interactions, and can be often influenced by fatigue, stress, or inexperience. If I were to make a medication error, especially involving a transfusion reaction, my priority would be patient safety. I'd stop the transfusion, stay with the patient, and take their vital signs. I would immediately escalate to my team leader and to the medical team. I would communicate transparently with the patient and family, complete a risk man, and document it in their patient notes. I would also reflect on what happened and why, and what I can do in the future to prevent this. To keep patients safe, I follow the 10 rights of medication administration. I educate the patient and monitor for side effects. I never leave medications unattended and ensure the patient is positioned safely. Before cardiac meds, I check for their blood pressure, and for insulin or high doses steroids, I check blood sugars. I stay vigilant on high-risk medications and refer to trusted resources like MIMS, the Australian Injectable Drug Handbook, and don't rush to crush. In haematology, I stay within my scope and do not administer chemo or immunotherapy. Patient safety is my priority, and through vigilance, communication, and reflection, I maintain high standards in medication administration. When I am feeling overwhelmed by high acuity, I prioritize early communication. I speak with my team leader and check in with my buddy nurse, especially at time-critical tasks. I use a shift planner to prioritize and tick off tasks, adding unexplained ones such as imaging, escorts, or theatre prep. I pause before entering a room to collect my thoughts and be fully present with the patient. A uni lecturer once said, "Wash your hands for extra long to catch your breath." To streamline care, I cluster tasks like doing OBS and medications together to reduce the interruptions for patients. If I still feel overwhelmed, I would reach out to my clinical development nurse or the grad support team. Nursing is unpredictable. Shifts throw curveballs such as a tissued cannula before IV antibiotics, a patient becoming incontinent mid-medication round, or a family member calling for an update that you've only just received the patient. In those moments, I focus on time-sensitive tasks and remind myself that nursing is a 24-hour profession. It is okay to hand over personal care or a wound dressing when needed, or stay back during handover to help finalise important tasks. At the end of the day, I reflect on what went well and what I could improve. If I've struggled, I would reach out to my mentors to debrief, but mostly I would try to be kind to myself. I'm committed to upholding the National Safety and Quality Health Service standards and work health safety legislation to protect myself, patients, and staff. I mitigate risks by using safe lifting techniques and equipment, wearing appropriate PPE for contact or droplet precautions, following protocols for hazardous substances, including cytotoxic drugs. I maintain knowledge of emergency protocols such as MET calls, fire safety, and evacuation plans, and I participate in drills to keep prepared. I also keep my patient's area clean and clutter-free to reduce falls risks. The Canberra Health Services values reliable, progressive, respectful and kind are at the heart of how I practice. Last year on my home ward, I cared for a palliative patient whose final wish was to pass away under a tree. Due to infection control protocols, we couldn't bring foliage onto the ward. Instead, I advocated for an alternatively. I arranged to take him outside, allowing him to sit under the tree with the sun on his face. His family later shared how much that moment meant. It offered peace, dignity, and a brief escape from the clinical environment. One of my proudest achievements is being nominated for the Kind Pin awarded by a colleague. I was also contributed to our ward's Consumer Recognition Award for compassion and care. Having worked as an enrolled nurse at the Canberra Hospital for over 4 years, I'm ready to take my next step. With my clinical experience and alignment with the Canberra Health Service values, this makes me a strong candidate for the 2026 Registered Nurse Graduate Program.